Welcome. My name is Dr. Mario Leyva. I'm a general and robotic surgeon here in Albuquerque, New Mexico. We're going to discuss several things today, specifically regarding patients, how to care for them in surgical wise, and how to make you feel more comfortable. I'm going to see you in my clinic. We're going to talk about things, but today we're going to give you some information so you can process, so when I see you later, we can have a good discussion. The reason for making these videos was to help the surgical process along. I've seen it from a surgical standpoint. I know how to do the surgery, I've seen it in clinic and so forth, but I've never really dealt with being a patient. And when patients come to my clinic, oftentimes they're overwhelmed with the amount of knowledge that I give them and other doctors, and they focus on that rather than listening to what's actually going on. So when they go home, their family members ask them, well, what happened? A lot of times they're like, I don't remember anything. So the reason for this is to help educate patients and family members and even providers and other people that want to be involved in the surgical procedures themselves. What is an inguinal hernia? An inguinal hernia is a hole or defect in the tissues of the groin or inguinal area. This area is prone to weakness, especially in males. This is the anatomy for hernias. There are several layers of the abdominal wall, including your skin, and the next layer is your fat layer, then a muscle layer, and the internal linings. A hernia occurs in a weakened area of the abdominal muscles and connective tissues. This causes your hernia to bulge, especially with lifting or strenuous activities. There are different types of hernias, as you can see in this picture. You can have abdominal wall hernias or lower inguinal hernias. Hernias can be associated with incisions, prior surgery, or can occur without any surgery. These hernias down here are called inguinal hernias. This is a direct hernia, indirect hernia, and a femoral hernia. Basically, all of these hernias can be treated in a similar fashion despite being different types. This is a picture that shows the varying degrees of abdominal wall hernias, early stage down to late stage. Basically, a hernia is a hole in the abdominal wall, which we call a defect. You can see here. Sometimes a piece of your intestine can come into this defect and either get stuck or reduce back down. When it gets stuck, it's called incarceration, where the intestine is trapped or incarcerated in this area. When this incarceration progresses, it can actually turn into a strangulation, where the tissue is being squeezed and loses its blood flow and eventually will rupture and cause spillage of intra-abdominal contents from that small intestine. You'll be very sick when this happens, and this is a surgical emergency. Surgery is recommended for any of these defects depending on the clinical scenario, and Dr. Leyva can help distinguish this for you. If you do have a strangulated, or you think you have a strangulated hernia, you should go to the emergency department as soon as possible. What are the symptoms of an inguinal hernia? Symptoms may include intermittent lower abdominal pain, radiation to the groin, nausea with or without vomiting, bloating, and occasionally diarrhea. These usually occur after heavy lifting or standing for extended periods of time and give a dull, nagging ache to the hernia site. These symptoms usually need elective surgical consultation and resolve with surgery. Symptoms may improve with lying down and avoiding the precipitating factors. Severe disease may also include intestinal blockage, infection, vomiting, and non-reducible mass in the groin, and necessitate going to the emergency department for evaluation. Who is prone to an inguinal hernia? Inguinal hernias can affect both women and men. It is more common in men and can be characterized by the 5 M's: men, manual lifting, muscle straining, multiple family members, and a mass or bulge to the groin. Is it very common in the United States? It is very common in the United States. It is diagnosed with a clinical examination and clinical history. Ultrasound itself may help rule other types of disease out, such as tumors or infections. How is an inguinal hernia treated? The only cure for patients with a symptomatic inguinal hernia is with surgical hernia repair, usually with a tension-free placement of a surgical mesh on an elective basis. Usually a mesh repair is recommended because of tension. Tension occurs where you try to close the defect or the hole to each other. If the hole is very large, trying to close that will become tight and the sutures will fail or the hernia will recur. There's a high recurrence rate with traditional suture repair. Thus, the recommendation is for a mesh repair which distributes the tension evenly. For example, in this hernia here, a mesh could be placed underneath the abdomen or between the muscle layers. Thus, the tension will be distributed evenly and help prevent the recurrence rate. When I do the surgery robotically, I also close the defect because I can sew upside down. Then I put a piece of mesh in either one of these layers to help give a better tension profile so the hernia hopefully will not recur. The hernias in the inguinal region are treated in a similar fashion with mesh for similar description as I gave earlier. A mesh is used to cover all of this defects. One single mesh can be used to cover all 3 defects. This mesh can be placed with a variety of techniques. The technique I use most often is called the robotic tap or transabdominal preperitoneal placement of this mesh. I make a small incision in the abdomen, usually up here, insert the camera, and then repair this hernia defects with a surgical mesh. Please refer to the hernia section. Unfortunately, hernias do not resolve and usually get bigger with time and thus harder to treat as time goes on. Elective surgery is easier and less risky than emergency surgery. How is an inguinal hernia repair done? An inguinal hernia repair can be done in several different ways. It can be repaired via a variety of methods, including robotically, laparoscopically, or via open techniques. Most of my patients go home the same day and rapidly recover over the next several days. Each of those methods have several benefits and risks and are tailored to each of the patients I see. Typically, I do a robotic tap procedure, which means placing the mesh behind the hernia defect, but the mesh does protect from the rest of the abdomen by that layer. This is important because it prevents any adhesions to sticking to that mesh. The type of mesh chosen depends on the individual patient profile. We have several options. What are the benefits of robotic surgery for inguinal hernia repair? As I mentioned earlier, I know how to do all the different techniques, laparoscopic, robotic, and open. But I prefer to use a robotic tap inguinal hernia surgery for my procedures, especially for bilateral or double hernias, and for recurrent hernias, and also for very large hernias. In my hands, it gives me several things. Number one, smaller cosmetic incision with rapid healing and improved pain profile. Number two, it also gives me the ability to repair both sides with the same incisions, and also to do complex surgeries through the same 3 little incisions. Number three, I have superior visualization at the time of surgery with the high definition camera, the 3D visualization of the robotic system, and it's more versatile in terms of the ability of the robotic system. This is in comparison to other procedures such as laparoscopic procedures. And number 4, finally, the ability to evaluate other intra-abdominal structures such as the intestine and other structures that may be involved in the hernia prior to placing the mesh. Is robotic surgery safe? It is very safe and is the most common surgery that I do. I have done the most robotic inguinal hernia repairs in the state of New Mexico, and it's rapidly growing as the preferred method, especially among minimally invasive surgeons across the larger cities of the United States. What are the risks of surgery? All surgeries have some degree of risk, but surgical risks include but may not be limited to infection, bleeding, injury to the surrounding structures, including the spermatic cord, and the hernia could come back, a recurrent hernia, although the recurrence rate is low. Also, other things such as wound complications are possible but less common. Minor risks include postoperative and growing discomfort, growing swelling, especially immediately after surgery, but this rapidly improves. Other things such as atypical scar formation are uncommon but possible. Expected pain recovery is very straightforward. Most people go home the same day and recover rapidly over the next several days with the regimen that I prescribe them.